alarming report from the CDC about the skyrocketing number of people with diabetes.
In our health, we all got a blunt wake-up call today about an epidemic spiraling out of control in America, diabetes.
New figures about diabetes in this country right now, it's estimated some 24 million people are living with the disease.
Diabetes has reached epidemic proportions. And what's driving the epidemic of diabetes, of course, is the epidemic of obesity.
And a third will suffer from diabetes at some point in their lifetime.
From a public health perspective, I have to say that we have a public health crisis on our hands.
When you have this level of poverty, you have a lot of people walking around with diabetes who go undiagnosed because they don't have access to medical care. When that happens, they end up developing more advanced disease, and they end up in the emergency rooms. And trust me, we're all going to pay for it one way or the other, because when they go to the emergency room, they're going to get taken care of. And if they've already developed their heart disease or their kidney disease or started to go blind, we're all going to pay for it. So as the guy says when he talks about changing your oil filter in your car, you can pay me now or pay me later. It's a lot more expensive if you pay me later.
Huge problem here in the United States, and particularly here in Texas. There are over 1.5 million people with type 2 diabetes in the state alone.
I see families who aren't coming with a child for a stroke who have to be told their child is overweight. I see families who come because their child's overweight and they've made the decision to see me. So in theory, I should really be able to motivate families to change. They're there because they want to see me for those reasons. And certainly we've diagnosed well over 500 kids here with type 2 diabetes in San Antonio over the last few years, and some are as young as 8 years old. It's not uncommon when they come in, the families tell me their grandparents had diabetes and they were diagnosed in their 60s or 70s, and their parents have diabetes, they were diagnosed in their 30s or 40s. But now their children have diabetes and they've just been diagnosed before their teenage years. So how do we break this dangerous chain?
Your son, even if you cut 50% of what they're eating, they're still consuming 3,000 calories or 4,000, because some of these kids are consuming 8,000 calories a day.
Obesity, diabetes, heart disease, high blood pressure are all diet-related health issues that cost this country more than $120 billion each year.
Everybody in South Texas has a family member or a relative who either has diabetes or has problems with obesity. And I know that's a very general statement that I'm making, but I think almost anybody can think of somebody important in their lives, be it a family member or a friend, that suffers from these issues. And I think that so much of the South Texas society has sort of become apathetic because they sort of accept that this is a way of life, particularly when you have it running in families. When you have families where everybody is obese, or you have families where everybody has diabetes, they sort of just accept this as a way of life, and that's just part of the hand they've been dealt, I guess, and nobody seems to be interested in trying to change their own fate.
Even though they see the complications right there in front of them, they still don't take it seriously. They don't wake up and say, this is going to happen to my child. My husband might have gotten this disease in his 30s. My child is 8 years old with this disease. If my husband has already had a foot amputated, what is going to happen to my child? What kind of life is this child going to have? Are they going to be on dialysis by the age of 20?
We're treating this chronic, silent disease in a community where people don't think that they need to see the doctor if they don't have any pain.
But we had a client that I sent into the hospital for acidosis, and he came back and the doctor put him from a oral medicine onto insulin. Came back to me on Monday and he said, "Sister, I've got this syringe and I got this bottle and I don't know what to do."
The current system of medical care is failing us, period.
We can address the causes, but there's so much work to do in a very short period of time and so many patients who need help that you simply find yourself overwhelmed.
Healthcare system will definitely be overburdened because if we do look at hospital admissions, people with diabetes, there are studies that have been showing, based on analysis of 2005 data, that people with diabetes have 3.5 times more hospital admissions than people without diabetes, and close to a fifth of hospital charges are a result of diabetes admission.
We need to work all together through funding, education, educating our providers.
In minority communities, the way that information flows, it's not from these outside organizations. It is not from professionals. It is from their cousin. My aunt told me this, that her friend, and that's how information flows. So just by them coming into their clinic visits, they see people in wheelchairs with both legs amputated. They see blind individuals walking around, and it doesn't faze them.
I don't mind the pain if I don't have to become an amputee, frankly. To watch somebody who was about 40 years old start to go blind and then have a heart attack at 42 and die because he didn't take care of his diabetes is what scared me.
Diabetes is hitting the low-income people. In my opinion, these people are all getting food stamps. At least, I think there's about 3 million Texans that are getting food stamps. There's 36 million in the United States. How long is it going to take to change that food stamp program? You're going to have vendors that are going to come out and really say that's not fair and you shouldn't be doing this. Although these are federal dollars coming down for SNAP, why should we let these people get sick and then pay federal dollars to take care of them?
Overweight and obesity across America and right here in San Antonio has reached epidemic proportions, and that it threatens the health and quality of life of millions of adults and children.
And I don't see any option but that this is going to continue to increase. We already have almost, as I've already illustrated, almost the entire population, except for maybe 15% of it, is already overweight or obese. That trend continues. We're going to see the rates of diabetes in this area that will probably be more like 50%. And that is economically unsustainable.
This is the pandemic of the 21st century. We've got it already. Never mind AIDS. AIDS never touched as many people as this is touching.